Hey guys, this is Dr. Sandy with another informational video on health and wellness. This is for you, your family and friends. Please use the information. You may use all of it, a portion of it, but I'm here to just inspire you and make you focus on your health and wellness. So, obviously as a chiropractor, my focus is the spine, the nerve system. The nerve system controls all major functions in the body, all the muscles, all the major organs. It's basically a gateway how the brain talks to the body. So we need a healthy system. We need a healthy highway, if I could call it that, and that highway is your spinal cord, and we want to take care of it. And we know if there's pressure on that spinal cord, if it's shifted, if it's not exactly where it should be, dysfunction occurs, and that dysfunction can affect everything from mood, focus, cause headaches and migraines, numbness and tingling, maybe in the arms and hands. Stiffness throughout the body can affect energy. It affects just organ function. It affects the legs. Things don't work right when there's pressure on the cord. And I think chiropractic is powerful, but it's a really simple concept. This is the major highway to the body. It's how the brain talks to the body. Let's keep the nerve system healthy. Let's make sure there's no pressure on the spinal cord so you can feel your absolute best. And of course, if someone is suffering, we want to help them. But once that person's healthy, the option we give them is to say, okay, now that you're healthy, let's maintain it exactly like the dentist. What does the dentist teach us? That brush your teeth, you go in for a cleaning, but then you go on a routine basis just to get that stuff maybe you couldn't clean. Going to the chiropractor is the same thing. You want to help whatever issues you've had, but what totally makes sense to me is once it's been corrected, you want to maintain it. And I think that's like owning a garden. That's like someone who likes to work out. They would never work out for 2-3 weeks and say, I'm done. You work out on a regular basis to stay strong. If you do yoga, you stretch on a regular basis, you brush your teeth. You want to eat good on a regular basis to get the benefits. And the spine, in the beginning, you might need more visits, you need more work in the beginning to get it corrected. But once it's stabilized, once you're in a good place, the spine is stronger and it's healthy, in my opinion, it makes sense to maintain it, to keep it healthy. And of course, that's an option we do give our patients, and maybe your chiropractor can give you that option as well. But that option of just saying, hey, now that it's healthy, just like a dentist, I want to maintain it. But I think the most common question I always get is that, why did it even shift? Like, how did the spine even shift? What are the major causes? And I'm going to generalize here, but just by speaking to a lot of people and patients and things, I think when we think of the spine, when we think chiropractic, we think a lot on the physical level. There's actually 3 causes of the spine shifting or moving. There's physical, chemical, and emotional. So I'm going to make a 3-part series. This is part 1. So it's going to be talking about how physical stress can affect the spine. So I'm going to start with sleeping. So the way you sleep obviously affects the spine, and you might be sleeping anywhere, hopefully at least 6 to 8 hours. If you sleep on your back, it is the best. Side is still good. Try to avoid sleeping on your stomach. Again, you want to customize for your body. If you sleep on your back, I would recommend a small pillow or literally like a towel on the back of the neck, a small towel at the base of your spine, and a big pillow actually underneath the knees. So they're propped up, prevents you from rolling. It takes pressure off the lower back. It would be a suggestion. You want to try that. If you like to sleep on your side, what you want to do is have the head. If you can imagine, if I'm sleeping right now on my side, a good pillow should be based on my shoulder. I should have a pillow between the knees, but what should happen is if the pillow is too small and not supportive, we see something like this. If it's too much support, we see something like this. So we want that neutral position as much as possible. Of course, there's going to be movement throughout the night. And I will tell you one thing. If you ever get up first thing in the morning and you feel sore or something doesn't feel right, there's a good chance that maybe when you were sleeping, something shifted or you didn't sleep in the right position. But if you went to bed pretty good and the next morning you're sore, there's a good chance it could be a sleep position issue, so something you want to look into. Another thing when it comes to the bed, a firm pillow is what I recommend for patients. A firm mattress, not so firm that it's uncomfortable, but more on the firm side is something I definitely support. So that's number 1. Number 2 is exercise. Now, exercise, it's this thing that we need to do. We need to have movement. The body likes movement, but it has to be done appropriately. So too much exercise obviously can be damage. Not enough exercise is not good. So you want to find that sweet spot. Now, unless you're competing for a competition, I'm going to treat that as a completely different category. For the general public, I like to recommend, and for my patients, anywhere from 3 to 6 days a week, some kind of workout. I think you need to do a mix of stretching, yoga, those kind of things. You need to do the cardio, the stretch, and you need some resistance. So I think to have a nice mix, what I'm personally trying to move towards now is maybe like 2-3 days of some cardio and some really, dedicated time for stretching. And then maybe 3 days of doing some resistance. And I'm going to play with that. I might do 2 of this, 3 of this, or whatever, but you should be having a model like that. And I think the 3 major categories are stretching, which is fundamental, and then the cardio and resistance. And I think what I've also observed, we all kind of have our favorites. I've had some patients say, man, I just love to work out. I just want to do resistance. I have some patients who just love cardio. There's some people who just do yoga. I think you need to do a little bit of everything, in my opinion. And again, 3 to 6 times a week, unless again, you're competing at a very, very high level. I think 30 minutes or less is better. I think less is more. Go in, get that intensity. Plus, depending on where you are in your life, but if you turn your workouts into an hour, hour and a half, or 2 hours, I question, will the intensity be there? Do you have the time? Is it sustainable long term? So think of those things. Of course, see what works for you. If you can do more than an hour and you feel great, hey, that's great. And that's the criteria too. How do you feel after your workout? If you've been a patient in my office for a while, generally speaking, treadmills I think are very hard on the joints. I would try to avoid that. I think elliptical would be a really good alternative. I think rowing machines, again, listening to your body, as long as you feel strong enough, I think that's a good option as well. Stationary bike, those kind of things would be good. But I've seen with a treadmill, people, I think it's very hard on the joints. So if you feel great with it, I'll leave that up to you. But it's something to consider, that maybe look at your other options. A big fan of the elliptical, as I already mentioned. Lifting weights, if you do lift weights, when I've seen injuries, when people have to be careful, I think when people do the deadlift and certain squats with high numbers, you have to be careful. So here's the philosophy I'd like to share with you with exercise. Why not choose an exercise system that you can do for a long time? I'm talking 20, 30 years, opposed to doing something dangerous, high weights, working out to point of failure. I think you have to, unless you are a trained professional, I think that system can lead to injury, in my opinion. So why not have tight workouts, good workouts, feeling refreshed, not to like, I'm collapsing, I'm getting injured, numbness in my body. That should not be happening. All your workouts should be refreshing, something you look forward to. You should be challenged, but you should not be in pain or getting numbness or tingling or feel like passing out. Those are not good signs. So something to keep in mind. That's on the exercise side. Now, the next thing is obviously tons of us now, more than ever, young and old, are using computers. There's so much obviously going on and stuff, but computers are not going anywhere. They're here, and we just have to adapt to that. So if you have maybe schoolwork, or if you have a job where you're just sitting all day in front of the computer, you got to be careful. And you would never think this, but actually a lack of activity, sitting a lot, is actually hard on the spine. It can lead to neck problems, back problems. It affects the whole body. So try to get up every hour. Try to drink that water. Make a stretch break. These little things make so much difference. Maybe get those desks that go up and down or something like that. But find ways, maybe use your laptop on a counter if you're working from home or something, but mix it up. The body's designed to move. When it doesn't move, you can actually lead to physical, just health problems, which obviously we want to avoid. And then the big one, and I think people think of their spine, or they'll say my back, or they think of chiropractic, is the lifting and bending. And of course that is a category, but you can see there's many layers to this story. But yes, with the lifting and bending, if you are going to do something out of your normal routine, like shovel the driveway, your friend calls you to move furniture or something like that, what I'd recommend, and it will save you so much grief, is just for 5 or 10 minutes, do some stretching before, do some stretching after, and just don't rush, get help. I find when people don't warm up, they do an activity their body's not used to, and they're kind of in a rush, they don't want to call someone because it's too inconvenient to go back into the house or whatever. That's when people get hurt. And your spine, as I said, controls every system in the body. We want to protect it. We want to honor the spine. It's such a precious part of the human body. So if we can just, warm up, get help when we need to. And sometimes, honestly, I would just, even if there's no one around, like, oh, I have to do it. Do you really have to do it? I would wait till someone's there to help you. So many issues of pain and grief could be avoided with just doing that and just warming up and let's say shoveling the driveway. Great example. Like, you know, it's going to take you half an hour. There's no rush. The snow's coming down. Maybe, you know, shovel the driveway for 5 to 10 minutes. Take a break. You did your stretches before and after. You know, go in for a glass of water, maybe a hot milk or whatever works for you. Come back. There's no rush. When you rush, when I've talked to a lot of patients when there's been injuries, it's a lot of rushing. Totally unnecessary, and obviously I want the best for you and your family. So guys, so this was category 1. This is talking about physical stress, how it affects the spine and nerve system. Next week I'm going to make another video on chemical stress, how what you're eating or maybe what you're not eating or drinking enough of, or how your diet basically affects the brain and nerve system. We'll go into that. And then the last one, which I think is the big one, which will be a couple of weeks out, will be the emotional stress. So high levels of emotional stress is probably the biggest cause of damage or weakness to the nerve system, leading to symptoms in the body. So we're going to talk about that. But today was about physical stress, and just wishing you all the best. God bless you. If you're enjoying these videos, I've been making videos for a long time. I'm really trying to, you know, give you that good energy. So if you're liking the information, if you could like, if you subscribe and share these videos, I'd really appreciate it. If you're, again, enjoying it, that would mean a lot to me. And God bless you. I'll be here again. Thanks again, Dr. Sandy.